How much does out-of-pocket medical cost eat away at your retirement income? We're going to talk about that for the third time. They say 3 times a charm. This is the third time I've done part 1 of this video. The other 2, the acoustics was just bad, the audio. So I'm going to try this again because it's incredibly important. So hopefully this will work. So heaven forbid that this doesn't work again, because this will be the last time I try, I guess. I don't know. I'll probably keep doing it until I'm blue in the face because it's so critically important. All right. So let's dive right into this, my friends. This is from the Center for Retirement Research, again, at Boston College. Paper dated October 2017 from Melissa McNerney, Matthew Rutledge, and Sarah Ellen King. They say, how much does out-of-pocket medical spending eat away at retirement income? We'll probably do this in 2 or 3 videos because it's incredibly important for you to understand. So let's go into this. And first, I'm going to start with the conclusion. Now, you can see I got lots of highlights, lots of notes in here and the whole thing. Now I'm just hoping the audio works because the last one I did was great. Just the audio was bad. I was like, oh, no. All right, so let's go down here to the conclusion. And we got lots of charts we're going to share with you, lots of references here. All right. This study examines the adequacy of Social Security benefits and retirement income, evaluated based on beneficiaries' OASI. And I don't know why they didn't put the DI, but OAS is Old Age Survivor Disability Insurance. And that's the first part of your FICA. So you got OASDI, HI. HI is Part A, your hospital insurance for Medicare. So they're talking Social Security benefits right here. Beneficiaries' Social Security income net out-of-pocket medical costs, including premiums, cost sharing, and uncovered services from all types of medical care, excluding long-term care. So we're saying how much is your out-of-pocket expenditures reduce your Social Security benefits, and then on top of that, your overall retirement benefits that you get, your retirement income. The results indicate that the median retiree in 2014 has 76% of his Social Security benefits left and 89% of his total retirement income left remaining after medical spending. Though this share vary widely across the post out-of-pocket expense ratios distribution, the average retiree, in contrast, has only 66% of the benefits of Social Security left for non-medical spending, and almost 20% of retirees have less than 1/2 of their Social Security benefit left. When considering all retirement income, the average retiree has only 82% of total income remaining for non-medical spending, and 6% of retirees have less than 1/2 of their total retirement income remaining. All right, a lot to chomp on there. We're doing 2 things here, the median versus the average. I just want you to focus on the median. The median is 50% have above, 50% have below. So the median says, if you factor in all out-of-pocket medical expenditures except for long-term care, and we'll dive into that here, 89% of your total retirement income is still available for you to spend on other things. 89%, that's the median. If we look at just the averages, and the average is going to skew things in terms of anything that has a zero bottom, which we do, and has an unlimited top, which it does. So we can spend $8 million trillion on the top, but you only have a zero bottom. So we know for a fact, if I have 0 expenditures and you have $100,000, our average is 50. If I have 0 expenditures and you have 8 billion, our average is 4 billion. And that's how the average can skew, because it has an unlimited upside in terms of expenditures, even income too. So we want to look at median, but even here with the averages, with the expenditures being skewed in the direction of more cost, we still have the average retiree still has 82% of total income remaining for non-medical spending. And 6% of retirees have less than 1/2 of their total income remaining. That stinks, but that's not a catastrophe by any stretch of the imagination. I'm just telling you, the difference between averages and medians is huge in this regard. And even the average retiree still has a significant amount of their income left after all out-of-pocket medical expenditures. And the median is even that much better. So that should give you some pause before you say, Medical costs are going to eat us alive when it comes to retirement. That should give you some pause to think maybe that's not true, actually. All right, because this takes into fact premiums for Part B, Part D, Medicare Advantage, and supplemental plans, which are Medigap, make up the lion's share of medical spending for most retirees, except for those with the highest spending. Thus, this is skewed in favor of the wealth, not in favor, but it's skewed because the wealthy spend more significantly than the other quintiles of the income. So if you have 5 quintiles, the highest quintile, the top 20% spend a lot more, relatively speaking, than the rest 4. And that is skewing the average expenditures north, right? Because they are spending much, much, much more, which the paper will show, than what the people in the other 4 quintiles do. And so premiums for Medicare, Part B, Part D, and Medicare Advantage, and that's Part C, and or Medigap, make up the lion's share of medical spending for most retirees, except those with the highest spending, which are going to be the wealthy typically, and then those, and that's what's happening. So the wealthy are skewing the numbers even less, or I should say more, to the spending side. So the average person is, in this case, that's why I want to use a median for sure. I hope that makes sense. It's a big flipping deal. And they talk about anything else I want to talk about here. No, okay. Not on the conclusion. So let's go to the top of this, and we'll talk more about this, but I cannot stress enough. Oh, that's what I was going to say, and I don't have it up there. But if we look at the Consumer Expenditure Survey, all right, from the BLS, Bureau of Labor Statistics, 89%, according to this, the study from the Center for Retirement Research, 89% of your total retirement income is still left over, which means 11% of your total retirement income is spent on healthcare. Guess what? 35% of your total retirement income is spent on housing, 17% on transportation, 13% on food. All right, there's like 12.5% on other. So 11% on healthcare is not a significant expenditure relative to the other things. Now, as you get older, the percentages on healthcare spending goes up to about 15%, and the others are about 12 to 13%. But housing still is a 36.5. So as you go up the threshold in terms of your age, your expenditure, your percentage of expenditures for healthcare does increase. But here's housing way up here. Here's everything else way down here. And they're kind of fighting for second, third, fourth, and fifth place. And until you're 70, I think it's 85, healthcare is the 5th most significant cost to the average household in retirement. Housing is always far away number 1. Healthcare is down here, number 5. And then it goes up to number 2 once you hit, I think it's above 85. All right, so let's go over to the introduction here, because I'm telling you, man, this is huge. Everyone, healthcare is going to kill us. It's going to make us poor. Oh, no. All right, so let's go down here. All right. Introduction. The general public and most policy analysts tend to evaluate the adequacy of retirement income and Social Security benefits in particular based on the level of retirees' total income. Most relevant to the purchasing power, though, is that their net out-of-pocket expenditure for medical costs, which are often considered non-discretionary. You need it or you don't. You do or you don't. Even though nearly all retirees over 65 are covered by Medicare, their out-of-pocket costs are substantial. These 2 researchers estimate that the average household spends $197 in their total for out-of-pocket health costs, excluding nursing care. Let's see. And some households spend much more, $311,000 at the 95th percentile. So the top 5% of expenditures for the people who spend the top 5% spend $311,000, which is skewing the average. I'm telling you, because the 95% and below spend a whole heck of a lot worse than that, lower than that. All right, Medicare enrollees pay for Medicare's Part B and D, and any supplemental coverage contribute a portion of the cost of Medicare coverage services they receive. So you're looking at Medicare Part B, roughly $135 a month per beneficiary. Medicare Part D, roughly $35 a month per beneficiary. And if you get a Medigap, I'm saying $150, or Medicare Advantage could be, literally probably a lot cheaper than that. Could even be $0, but you still got to get Part D on there. But anyway, we're looking at roughly $300, $350 a month per beneficiary. All right, the most recent estimates show that the median Social Security beneficiary enrolled in traditional Medicare spent $3,600 on out-of-pocket payments in 2001, nearly 1/4 of his total Social Security benefit. And the U.S. Social Security Administration indicates that about 12% of the median's household total income is spent on Medicare, or medical out-of-pocket cost. Again, excluding long-term care. I mean, again, that seems dastardly until you look at the other stuff. Housing is 3 times that. Let's keep going down. This project decomposes out-of-pocket spending by 2 types, specifically premiums and cost-sharing uncovered services. It is important to separately. Jeez Louise. It is important to separately document these out-of-pocket spending categories because the amount spent on cost sharing and uncovered services may be more unpredictable from year to year than premiums. We know your Medicare Part B will be $135 adjusted for inflation. Your Part D is $35 adjusted for inflation. Your Medigap policy is probably, like I said, $150. Your Medicare Advantage could change, but roughly you have a good idea it's going to cost between $300 and $350 a month for those things, or $3,600. All right, so this is what's interesting. The main results exclude long-term care. Long-term care spending in order to characterize the relationship between out-of-pocket spending and Social Security benefits or retirement income in a typical year. So we're trying to look at just a generalization of what you could expect to pay of your overall Social Security and retirement income. Long-term care is not a typical year. Although the cost of nursing homes, so listen to this now, the cost of nursing home care can be very large. Many retirees never use nursing home care. Did you hear that? Many retirees never use it. And those who do typically only enter a nursing home after they reach their 80s and only stay for a short duration, an average of 0.88 years for men and 1.44 years for women. Though the cost of nursing home care can be quite large, many retirees never go to a nursing home, and when they do, they generally stay for less than 1 year for men and less than 1.5 years for women, and only after the age they reach their 80s. This analysis separates the sample by age, by gender, by the type of supplemental insurance, by health status, i.e. the presence of chronic conditions or limitations in activities of daily living, and by income quintiles. We're going to look at 5 quintiles. Because Medicare's out-of-pocket costs are often substantial, and because some key services such as dental, vision, and hearing are not covered by traditional Medicare, enrollees often acquire supplemental insurance coverage. The main 3 types of supplemental insurance the project is examined: Medicaid, the public insurance program for low-income individuals, Medicare Advantage, Part C, and retiree health insurance, they're calling RHI. They don't talk about Medigap, which is odd because that's Medicare supplemental. They throw it under this other category, but they don't really address it very often, which I find odd, but whatever. Prior work consistently finds that Medicaid enrollees have the highest share of post-out-of-pocket expenditure for income left over. In most cases, this is followed by Medicare Advantage, with enrollees with no supplemental insurance and enrollees with private insurance having the lowest share of out-of-pocket expenditures, of out-of-pocket income. So what that's saying, and initially this kind of bothered me until I thought about it. Medicaid enrollees have the highest share of post-out-of-pocket expenditure income. So the ratio of how much they're spending relative to their Social Security and other retirement income is the lowest. That means they retain the highest. I said, that's not right, man. Medicaid, i.e. the poor people who are getting welfare essentially to pay for their Part B, to pay for their out-of-pocket coverages, to pay for their Part D, they have more money left over relative to the Social Security benefit. And I said, once again, that ticks me off. But there's more to the story than meets the eye. We'll talk about it here in a little bit. So before we start going crazy, don't, because let me just explain. Medicaid, they don't have much of a benefit to begin with. All right, Social Security benefit. So if they're $15,000 a year is what their benefit is, and they're keeping $13,000 a year, that's a higher ratio than some of the $25,000 benefit is keeping $22,000. Would you rather be the guy with $25,000 who's keeping $22,000, or the guy with $15,000 who's keeping $13,000? I mean, so that's kind of what's going on here. So, all right, so let's pause there. We'll go back to the literature. I want to make sure this audio is looking good because, again, this is the third time I've done this. If it's not looking good, I might just have to stick my head in the oven and slam it hard. But we should be good to go here. So we shall see, and stay tuned and watch for part 2 of this here in just a second. Thanks, guys.